There we go. Rhiannon, is that okay? Can you see that?
Yeah, that's good for me.
Perfect, thank you. So, hi everybody. My name's Rachel Garbus. My pronouns are she, her. I'm the team manager for the West Yorkshire Neurodevelopmental Family Navigator Service Pilot, which is what we're here to talk to you about today. And I'll be presenting alongside my colleague Zoe Earp. Thank you very much for having us. It's lovely to be here. And thank you to all of you who've taken the time to come and to listen to us. Please feel free, as Rhiannon said, to keep your cameras on and off. It's entirely up to you. Copies of the slides will be given to Rhiannon at the end so that she can distribute them wider to people who would like a copy. Rhiannon's already mentioned, but if you didn't hear, please feel free to use the chat throughout if that's helpful to you. And Rhiannon and her team will monitor the chat for us. They'll stop us if they feel it's appropriate. Otherwise, we will have some time left at the end for some questions and answers. We'll also share all emails and contacts with you at the end of the PowerPoint on the final slide. So I'll hand over now to Zoe, and Zoe's going to introduce herself and the rest of our team.
Hello everyone, I'm Zoe Earp, my pronouns are she, her, and I'm the ND Service Coordinator, as well as a key worker from the West Yorkshire Key Worker Service as well. I'll hand over to Yasmin.
Hi everyone, I'm Yasmin Sharif. I'm the Programme Manager for the Navigator service, and lovely to be here and see you all today.
Oh, thank you. And we have Olivia Featherstone, who is our Service Administrator, and I'll pass on to the ND Family Navigator, Jan.
Morning everyone, my name's Jan, pronouns she, her, and I'm the ND Family Navigator for Bradford.
Thank you, Jan. Then we'll move on to Carolyn.
Morning everyone, I'm Carolyn Rhodes. I'm the Family Navigator for Calderdale.
Thank you. And Gemma.
Morning everybody, my name's Gemma Blackburn. My pronouns are she, her. I'm the Family Navigator for the Kirklees area.
And Dana.
Morning, my name's Dana and I'm one of the family navigators currently working with some of the families in Leeds.
Thank you. And Janine Harris is the ND Family Navigator for Leeds, who is unwell at the moment, which is why Dana is working with the families from Leeds currently. So today we'll look at the aims for our NEDtalk. So initially we'll be looking at our vision and priorities, moving on to the service delivery, including the delivery models for each area. Pilot service impact, including the case studies and stakeholder engagement. And then finally, we'll be looking at next steps for the pilot service, as well as the future plans.
Thanks, Zoe, and everybody else. And so I'll take you through our vision and our priorities. So we're supporting families in Bradford, Calderdale, Kirklees and Leeds through pre-diagnostic peer support. Wakefield are not a part of the pilot due to limited funding. However, the learning will be shared across all 5 places. So and we're here to support families. Our priority is supporting families in need of some support whilst they're on the assessment waiting list for autism and/or ADHD. And one of the ways that we're doing that is to introduce peer support from experts by experience and provide some adequate training. So all of our peer supporters, our ND Family Navigators, have completed or they're enrolled upon an autism peer support course. And this has helped us to really understand and define what we want from our peer support. And it's very much to be that listening ear for our families, to develop equal and trusting relationships and improve that depth of understanding. We're respectful of all opinions through our peer support work. We use our lived experience in a safe and appropriate and trauma-informed way. And our navigators really are effective communicators. They'll respond to communication and needs, including equality, diversity and inclusion, and really considering intersectionality on those peer relationships. They're committed to working collaboratively, looking towards building and sustaining and ending peer relationships. They're a very open-minded team. They'll look at reframing situations and working on strategies and learning from one another. They're patient, they're resilient themselves, and really do encourage families to develop their own resilience in very challenging situations whilst on the assessment pathway. They might be looking sometimes towards making transitions, managing transitions and future planning, and they're very insightful. So understanding rights and entitlements for our families and supporting them to make some informed choices. We're looking towards preventing potential crisis and deterioration of wellbeing for a family, accessing relevant information and signposting to local community support, and involving our parents and carers and professionals throughout to improve our service delivery. And in and amongst all of this, we're very vigilant in keeping our families safe, and we'll work within those professional and legal frameworks. I'll hand over to Zoe, who's going to talk you through some of our outcomes.
Thank you, Rachel. So if we look at the outcomes, which we're working with the parent and carers, these will be decided with the navigators. So it's not a case of working towards all 5 of these outcomes. It's person-centred, so it will be what that parent or carer requires from the navigator service. So number 1, reduced parent-carer stress. 2, signposting around education. 3, signposting for local support. 4, signposting around benefits. And 5, increased understanding of neurodivergence. Thank you.
Thank you, Zoe. Thanks for covering those. So we've had a brief overview around our priorities. So now we'll have a look at the service delivery. I'll do a brief overview on the timeline of the service from September 2023 through to now. We'll look at the criteria to access the service. We'll look at the different delivery models across each of the 4 areas. And then I'll give you some insight into the numbers of families that we've supported so far and what our outcomes are actually telling us at this point. So in September 2023, we secured the funding for the ND Family Navigator pilot from Health Education England, and we began the recruitment process. In June 2023, we met with commissioners and assessment teams for each area to agree protocol and processes. And then each area started to go live. So in September, Bradford went live first. In October, it was Calderdale and Leeds. And in November, it was Kirklees. And the possible end to the pilot was September 2024, which was subject to funding. And we're happy to say that we did secure some extra funding through to March 2025. Zoe, would you like to talk us through the criteria for the service?
Brilliant. So the criteria for the ND Family Navigator service, the parent or carer should be on the assessment waiting list for autism, ADHD or both. Their child be of preschool or school age. It's worth noting here that preschool is autism only due to the ADHD referral remaining over 5 years of age. Be in some need of support and also reside in the West Yorkshire area. That's Bradford, Calderdale, Kirklees or Leeds.
Thank you, Zoe. So over to the delivery models and the referral pathways. So the delivery models and the referral pathways were designed in collaboration with each area, very much as a bespoke model. We agreed across all areas that we would offer a short-term intervention of up to 10 sessions and that this is a service that requires consent. So standards were set within the service, both in terms of what successful outcomes could look like for parents and carers, and also what standards we would need to reach with our ND Family Navigators so that they could become confirmed in post. And it was important that we worked together with each area to define quality from the offset. So we've tested things continually throughout this pilot so that we can make changes and we can carry out progress monitoring to continually check that we're meeting standard. There were obviously some things that we couldn't plan. For example, the start of the pilot was all about getting things off the ground, and we couldn't imagine what the pilot would look like in September 2024. So we developed it bit by bit, and we continually engaged with each area, each ND Family Navigator and our families so that we could test things out and we could evolve. I provided regular progress updates to each area that included monthly data, schedules for actions, and explanations behind what we were doing and why, and that included contingency measures. So if you look over to the right-hand side of the slide, you can see the referral pathways in the table, and they're noted there for each area. So Bradford, Calderdale, Kirklees and Leeds. Now, each area began with referrals to the service being made by health, apart from Kirklees, who, when the service began, they initially instigated self-referrals. And over time, the service in each area has evolved. Some referral pathways were extended over time so that we included referrals that came to us from outside of health, and they're all listed there on the right-hand side of the table in darker green. And the breakthroughs that we had in terms of increased referrals, engagement with other agencies and professionals and families really has taught us a lot. So just how many, just what do referrals really look like within our service in September 2024? We've received a total of 316 referrals since September 2023 when the pilot began. And this includes 20 parents carers who are new referrals at this time, so they're currently waiting for contact from an ND Family Navigator. There are 14 parents carers who didn't choose to receive the service at this time. So note that they can re-refer back to us when the time is right for them. We do appreciate sometimes it's just not the right time for a family to receive a service. 8 parent carers who referred via self-referral, the self-referral mechanism didn't meet criteria, i.e. they were not on the assessment pathway. And we had 2 parents carers who re-referred to the service. And we've got 94 parents carers who've completed their work with the service. So our ND Family Navigators, Jan, Carolyn, Gemma and Dana, are currently supporting 245 families. So what do our outcomes tell us at closure? Noting that 94 parent carers have finished working with the service across Bradford, Calderdale, Kirklees and Leeds. Zoe's already given us an overview of the outcomes on the previous slide, and you can see these here again on the bar chart to kind of let you know about those again. We had reducing parent carer stress, signposting around education, signposting for local support, benefits and that increased understanding of neurodivergence. So the figures represented in the bar chart are taken from those 94 parent carers who finished their work with the service. And most parents carers across all 4 areas have worked with their ND Family Navigator on increasing their understanding of parenting their neurodivergent child. And this figure currently sits at 62%. We've got 61% of our families across the 4 areas who've received support to reduce parent carer stress, 52% signposting around education, 48% signposting for local support, and 21% signposting around benefits. And just to reiterate, as Zoe already mentioned on the other slide, not all outcomes would be appropriate for any one family. For example, for a particular family, only one of those outcomes may be something that they choose to work on with their family navigator. Zoe.
Thank you, Rachel. So now we're going to consider the pilot service impact with 2 case studies that represent some of demonstrate some of the work which the ND navigators have achieved with the family. So I'll pass on to Rachel for case study A.
Thank you. So I'll talk around this. I appreciate it looks like quite a lot of writing on there, but we felt that these case studies were key to really exemplify some of the outcomes that we've worked towards. So case study A is a young person, 14 years old, who was on the assessment pathway for autism and ADHD. They'd been waiting for their assessment for 2 years, and they were also waiting for a communication and language assessment. They'd been out of education for 3 years, and they didn't have an educational healthcare plan in place, an EHCP. They had 2 younger siblings, and mum was due to have a baby in 2 weeks' time. They'd already received some support from social services, early help and hospital education needs, and they received regular welfare checks from the school, but very little seemed to be working. This young person was withdrawn, very reluctant to engage with services, and mum was understandably feeling overwhelmed with the system and all processes. She was having multiple professionals visit the home. She was very concerned about her finances and the imminent birth of her baby and the support that was needed for her child who was on the assessment waiting list. So when our ND Family Navigator made her first visit to the home, it was really clear that the family was heading towards crisis. Our ND Family Navigator communicated with other professionals to better understand their role, including when and how often they would visit, and she began some joined up collaborative working with the family voice and needs at the centre of all her decision making. So Mum and the Navigator worked together on all 5 outcomes and they planned out the next steps. The Navigator explained the processes throughout, and she really did do some work to reduce Mum's stress and increase her resilience. She offered a mixture of sessions that included face-to-face work, some phone calls and some support to attend meetings. And she was very much that peer supporter and listening ear as somebody who herself had lived experience. She explained the importance of engaging with the assessments that were due to take place and were very much needed at that time. And she saw some additional funding through a Barnardos cost of living grant, which was also available at that time. She had a real accurate understanding of the family situation and the barriers and escalations that might arise through the assessment process itself taking place. And she attended a core group meeting with the area, with members of the assessment team, and she offered feedback on this case study with consent from the parents. And the assessment team reflected on the potential triggers and barriers that could take place through the assessment process itself. They made some reasonable adjustments that would encourage engagement and increase the chances of that assessment taking place. The ND Family Navigator also worked very effectively with Early Help, who we said were involved at that time. She signposted heavily around education. She supported Mum to contact and meet with the school to seek information that was required for the HCP, but that Mum was really struggling to get hold of. And there were some failings from the school that were acknowledged, and they were investigated by the senior leadership team, and the school then supported Mum through the mediation process. And after we closed the support, Mum referred back to the service a short time later, and due to the nature of the complexity around this, we continued to work with her for an extended period. Mum's offered some feedback to us, which she's happy for us to share. And she said, you can have degrees and qualifications, but no one is more qualified than someone with lived experience. I wish I had the Navigator service supporting me from the start. I'll hand over to Zoe, who's going to present on case study B.
Thank you, Rachel. So case study B, the young person is 9 years of age, was on the assessment pathway for autism and ADHD via the right to choose pathway. They had chosen the provider with the least amount of waiting time, approximately 6 months, and had already been waiting for 2 months when they referred to the ND Family Navigator service. They had 1 younger sibling and a very supportive family. They had already accessed support from Family Support, Early Help, CAMS and Unique Ways, which is a parent carer-led organisation. The young person did not have an Educational Healthcare Plan, EHCP, and was not on the Special Educational Needs Register, SEN Register, at school. The parent mum had a very busy schedule, so the ND Family Navigator adapted her visits and plans around family life so that they could work centred around mum needs as well as the needs of her son. Mum was experiencing many struggles and was in need of a listening ear from somebody with lived experience who could support her to navigate the systems and also advocate effectively for her son. So she and Mum worked together to plan the sessions. They worked on all 5 of the outcomes with a different focus for each session so that the support was not overwhelming. They used a variety of face-to-face sessions as well as phone call check-ins on top of this. The ND Family Navigator worked with Mum to use some person-centred tools to plan for a meeting that Mum would attend at school. Mum had previously shared that she felt unheard and was anxious to attend. So the ND Family Navigator heard this and then supported Mum to develop the resilience to speak about what was going well for her, but also what were her concerns. She also planned for her contributions to detail what was going well for her son and what his own concerns were at school. Mum then asked the school the following same 2 questions. What was going well for them and what were their concerns? Mum felt that she had some structure to the meeting and her input would be heard and valued. From that, the school considered what reasonable adjustments could be put in place that were not diagnosis driven and added the young person to the SEN register. The ND Family Navigator supported Mum to contact SENDIAS, which is the Educational Support Service, and spent a session talking through the application process for an educational healthcare plan. Some feedback from the parent was the following. This service has been an absolute godsend. The navigator was so friendly, informative, and understanding of my situation. It was a joy to talk to someone who actually understood what we go through as parents on the neurodivergent pathway. I just wish that this programme was for longer, as it's been so helpful. But I still have a long way to go on my journey. I do understand I can refer back in the future, but really don't want the programme to end. The navigator I had was an absolute star and worth her weight in gold. Thank you. So next we're going to have a look at what the questionnaires tell us. So we've received 50 responses, which is over half of the parents which we've worked with on the questionnaires, and we'll have a look at what they tell us. So 100% of the parents and carers scored 5 out of 5 when asked if accessing the ND Family Navigator service has had a positive effect on them as a parent or carer whilst being on the waiting list for an autism or ADHD assessment. 98% of parents scored 5 out of 5 when asked if they were satisfied with the information that they had received from their ND Family Navigator around their options for continued support at this time. 96% of parents and carers scored 5 out of 5 when asked if they were satisfied with the number of sessions of support that they had with their ND Family Navigator. It's worth noting here that we considered this feedback and we understood that the parent did want more sessions. So that was the point where we looked at re-referring back in, and interestingly, that was the parent from case study A. And finally, 92% of the parent carers scored 5 out of 5 when asked if they'd found it useful to speak to an ND Family Navigator because they have lived experience of a disability and or parenting a neurodivergent child. So next we'll look at some of the quotes from the questionnaires. So the service is amazing and essential for families as it provides the support and advice families need. My navigator helped me through my tough time and supported me through to the end. Thank you very much. I'll pass on to Rachel.
I was feeling lost at the beginning of our sessions, and our ND navigator gave us back hope and pointed us in the right directions with information to provide our child with a new start. Thank you from the bottom of our hearts.
A massive support for myself and my family. I couldn't have wished for more. She has been amazing and understanding and extremely supportive and professional. She has actual life experience with the areas and she has helped me with, which made her the perfect person to receive this support from. A very lovely, caring, helpful individual.
My ND Family Navigator was an understanding, non-judgmental voice that helped me to have confidence in my own understanding of my child's neurodivergence. She also provided encouragement and helped me to seek support from school. By just talking to her, I felt that my own voice was heard and validated for the first time ever. At the beginning of my ND Family Navigator journey, I felt anxious and confused. And now at the end of my journey, I'm feeling optimistic and confident in my own ability to advocate for my child. So what are our next steps and what are our future plans? So our next steps and future plans until March 2025. So we will have some finalising independent evaluation partner. So we're looking towards evaluating this project, and we're meeting with them in the next couple of weeks to finalise bringing them on board. The aim is that this will be completed by the end of February 2025, and dissemination and learning events from our evaluation will be planned in. We may be able to come back to a NEDtalk again and present on those once we have them. We'll continue our follow-up discussions with place-based commissioners. We'll consider options for the pilot and the importance of early support for families. Zoe and I and Yasmin and the team, we are looking towards exit planning, and we're developing an exit strategy should we close in March 2025. If this did take place, we would inform all our families and our wider stakeholders. And until then, we will continue to support families across all 4 places until the end of the pilot. So in summary, from our NEDtalk today, hopefully we've given you some oversight into our vision and priorities for the pilots. We've talked about service delivery, including the different delivery models for each area. We've talked about the pilot service impact. We've included a couple of case studies for you and tried to give you some insight into stakeholder engagement, including those questionnaires, which when they're given out to parents, they gather some quantitative data, but also some of the qualitative data, which you heard through the feedback that we gave you with the quotes. And I've also given you a little bit of insight into our next steps and our future goals and our future plans. All of the contact details from the people who presented on the PowerPoint today are here. So if you do need any of those, please bear in mind that this PowerPoint will be shared at the end. And if you need to make contact with any one of us, you're more than welcome to do so. We'd be happy to hear from you. So we've reached the end of the presentation, and we'd like to take it out to all of you to see if you have any questions for us. Thank you. Thank you for listening.
Thank you so much. That was
Excuse
really
me, can I
informative.
just say, I'm just on the phone to MindMate, and they're saying that self-referral via MindMate is incorrect.
It's on the
In
ND
Leeds.
Family Hub. It's on the ND Family Hub in Leeds. Does that make sense?
I'll Google it.
Yeah, we'll put it in the chat. We'll
Link.
put it in the chat. Good one.
Yeah,
Zoe, are you okay to put it in the
It
chat?
definitely is on there.
Yeah.
Bob, should we bring you in?
Hi, can I take this opportunity to try and explain verbally what I'm having difficulty explaining in the chat? The slide deck is what you've just seen. It's every slide. Think of it as a piece of paper printed out and put together as a booklet, if you like. That would be a deck of sheets of paper. This is an electronic facsimile of that. It is all the slides put together in one lump, for want of a better expression. Does that help?
I get you. Thank you.
Yeah. Does that work?
It does. Yeah.